All right.
Whoa, we're here.
Hi.
Welcome to Just Massage Therapist podcast, where we are just massage therapist and a physiotherapist. And these are just our opinions, just our thoughts. Don't hold it against us. And yeah, we're going to chat about some things with our very special guest, Allison. Allison, would you like to introduce yourself a little bit?
Sure. Yes, I'm Allison. I am a physiotherapist in Saskatoon. I actually work with Cora, the same clinic. I'm the clinic director there as well. I've been a physio for 13 years, primarily working in orthopedic and musculoskeletal practice, but I delve into some neuro conditions as well. I mean, some stuff that kind of comes with your musculoskeletal things like peripheral nerve injuries, spinal cord injuries, but I have a special interest in Parkinson's syndrome and stroke rehab as well. So, and actually quite a bit in Bell's palsy because I do acupuncture as well. And so it's quite good for Bell's palsy, especially if you catch it early. So, and I also do dry needling. So I spend a lot of time with needles in my hand. And yeah.
That's a scary thing to say.
Right. Yeah. And I didn't realize quite how often I actually do dry needling and acupuncture until I had a physio student last year. And we look at the day and go, okay, so now I do needling with that one and that one. Oh, and that one. So I will find something for you to do today, but yeah.
Oh, don't forget to hit go live on your Instagram.
Okay.
Sorry, I forgot to remind you.
I'm hitting it and it's not doing anything, but that's okay. It's all
that I'm sorry. Instagram is so picky and so tricky. It's irritating.
It's all good. It may be because there was one from the practice. I'm not sure. Doesn't matter. No big deal. So
that's okay.
All
we're all good in the hood.
We're all good. Yeah.
Except for I'm definitely not in the hood. Cora's closest.
Yes. Exactly.
I'm there.
she's on the edge of the hood.
Just on the edge. Yeah.
Cuss.
Fine.
All it's gonna take is like one move, and then we're in it. Though.
There you go.
Exactly. Good point. I forgot to change our background. There we go. Freak! I forgot to change our background and everything. It's just ridiculous.
Yeah, we just were having too much fun beforehand. So.
Oh, we're definitely having too much fun. For everybody who is joining us, as per usual, if you are on YouTube or on Twitch, we can generally see your stuff right in the chat here. If you're joining us through Instagram, then I have to go back and forth and look at any comments that might show up. So if you do comment and we don't get to you right away, that is why. And then for those of you who are watching this later, please make sure you leave us a little comment or a like or something that lets us know that you're enjoying our content. You can also tell us to, change our ways, and we probably won't listen.
We'll consider it, though. We'll hear you.
We'll hear you out.
We're all inclusive.
Yeah, we'll listen and we won't judge. Well, I'll judge.
Maybe she will, but yeah.
Oh, I love it. It's so fun. Okay, Cora, what is our topic today that we are chatting about?
Well, today we're talking about referrals. So I thought it would be a really great idea to have Allison join us today because I feel like physio is one of the nobody really knows exactly when to go.
Right.
So I felt like having a physio on board with us today would be a great opportunity to just clear the water and get the information.
All right. Well, I'm going to do this wonderful transition over here because this is really a you guys show. And I'm kind of background noise today, which is a fun place for me to be. So, Cora, take it away with some questions and I'll just chime in here and there.
Deal. I guess one of the big questions that I have for you is when do you feel like it would be the most beneficial for physio? Like when it would be the most beneficial for like a massage therapist or another practitioner to refer to physio?
I think that the beauty of physio is that we have such a wide breadth of abilities and knowledge that we can kind of hit at any point. Especially if we have someone with really chronic conditions, I would say that's a really wonderful time to start looking towards us because, yeah, well, medications and things like that can be good. Sometimes we need to take that more holistic approach where we can work together and, we have the ability to look at muscles and stuff like you guys, but we can also then look into the joints and in a little bit more depth than I know. I know you guys could do some of that as well, but just finding that next stage. I see a lot of people with chronic stuff. It's funny because I think sometimes people think of physio as for more acute stuff with like a more acute injury, an ankle sprain or something like that. But I would say that probably 75% of my caseload is people coming in going, I've had this shoulder pain for 3 years and I'm finally sick of it. And I just thought it would get better kind of stuff. Um, so I think that's the beauty of physio is that we can kind of tackle anything from acute to chronic, um, and anything in the body. Like I said, I do musculoskeletal a lot. I do some neuro stuff. We can do cardio resp things. We don't see that in a private clinic as much, but I've had a couple of clients over the years with stuff like that, uh, both with pneumonia, which is ironic considering I currently have pneumonia.
I was about
So the irony there, but I think probably if you're seeing someone who especially is really struggling with that chronic pain where they come and going, I have felt really good after my treatment with you, but it's just not lasting. I think that's where maybe some of the other techniques we have can start to play in a little bit more to work together to figure out, okay, what else is maybe going on, or how do we have to work together to get that like longer lasting relief for someone.
Mhm.
Yeah, I don't know if that answers the question really, but yeah.
No,
I
for
think
sure.
it really does. Yeah.
Okay. Good.
I have a follow-up question, if that's
Sure.
okay.
Yeah.
I find it really like challenging to tell someone, "Hey, you should go see a physiotherapist," and
Right.
them turn around and go like, "Well, don't I have to talk to my doctor and get a referral,
Mhm.
everything?"
Right.
And I don't know how to help them on that process.
So the beauty in Canada is that at this point you don't need a referral from a physician. It used to be that you needed it for your benefits more so than anything. So there may be the odd benefits company that still requires a referral to physio to for them to cover the cost, but we are direct entry. So any physio will say, yeah, no, just come on in the door, no referral
I
needed.
don't think a lot of people know
Tell me
that.
what's going on. Yeah, it's changed a lot because when I first started 13 years ago, it wasn't the case. You needed to have a referral for coverage at the very least. So it was sort of assumed that you just needed a referral to be able to come through the door. So, but we've always technically been direct entry. It's more the funder that needed it. And I'm so glad they did away with that because, I mean, just cutting out that middleman, hey? Like, why do we need to burden that healthcare system or by having to go see your doctor to get that piece of paper for them half the time, literally to just write, please assess and treat. And it's like, oh, yeah,
Okay.
that's my job. Cool. That's what I do. Yeah. And like half the time, I don't even see a body part on there. So it's not like, hey, it's their shoulder. It's just like, please assess and treat. Cool, cool,
Yep,
cool.
and the doctor trusts you to do your job.
Yes, which is like so fair. I mean, right? Like if they're like, "Hey, we trust you. We know you got this. Don't worry about it." There is sometimes where I'm like, I kind of wish they'd just be like, "This is what I think it might be." Even just like a hint. But a lot, I've had sometimes people walk in where the doc's like, "I don't really know." So, there's something's wrong with their shoulder. You figure it out. So it's good. But I actually had a doctor when I first started out. I worked in the clinic right down the strip mall from us. Came in to see me, and I remember seeing his name in the schedule, going, "Okay, that's not a super common name, but it's a common enough name that this might not be that doctor, but it could be." And it turned out to be. And of course, I was having a little bit of a mental breakdown because I was only like 6 months into physioing. And I was like, but he's a doctor and he knows everything, and I'm going to look like an idiot. And he was sitting in the chair and, explaining what was going on and all these medical terms. And I said, okay, so yeah, you're the doctor from next door. And he's like, yeah. And I said, so have you had any of your colleagues take a look at it? What do you think's been going on? He goes, oh God, you guys know more about this than we do. That's why just came over here instead. And I was like, oh, okay, good. Like, it was that moment of, oh, okay, cool. And thankfully I got him feeling better. So we were good, and it actually built a really wonderful relationship with him, because then I had a couple clients of his. I still have clients of his years later, and one of them I felt needed an X-ray, and I sent a note over and just said, hey, I really think you benefit from an X-ray because of this and this and this. What do you think? And a lot of the time when we do that, people still have to book an appointment with their doctor so they can check them out, because they're not just going to necessarily take our word for it.
Mm-hmm.
He called them and said, hey, she said you wanted an X-ray, or she wants an X-ray for you. Here's the rec. Just go and get it done. So it's cool to build those relationships and kind of build that, I guess, reputation, is like, we do know kind of those things too, what we're talking about with that. So
cool.
Yeah.
So
But
cool.
yeah, long story short, direct entry. So that's the beauty of it. People can just walk through the door. And I think most clinics these days do direct billing as well now too. I know ours does. We direct bill to pretty well every major healthcare funder. It started with only a couple. It's grown. I don't think there's really many now that we can't. And I think most clinics are the same way. So that's nice too for people. We've had people have to pay nothing at an appointment. We've had people pay literally $1. Yeah,
God, I miss that.
like, so you owe $1, and some of it might be $12 or $15. It just depends on the funding. So
I really miss that. Not gonna lie. Oh, there's only like 1 or 2 places here that will cover massage.
oh, that's too bad.
Oh, I know it's awful, but I don't blame them, because most places in California
Oh,
need 550 hours of training. That's it. So
oh,
yeah, I
okay.
don't blame them for not wanting to cover,
Yeah, fair enough. Right.
right?
Yeah.
I want them to cover me, because I have
Yes.
so much more than that, but
So much more. Yeah, fair enough. Hey.
it is what it is.
Well, it'd be interesting to see how things may be changing here in Saskatchewan with the push towards the Crown legislation and stuff too, with coverage for massage and in particular with some of the WCB and like motor vehicle accident funders and stuff like that, on kind of giving more onus to massage therapy, because I think unfortunately in some funders' eyes it's still just seen as like a nice adjunct thing. It's just a relaxation thing. It's just to make you feel like nice, and they don't necessarily see it as therapeutic, which of course it is if you go to the right person. So so yeah, I think hopefully we can see that start to move into other places as well. So
Yeah, there's lots of things happening with that umbrella, with that legislation there. I'm excited to see it happen. I'm excited.
Yeah,
It's happening really fast, actually, surprisingly fast.
yeah, that's good.
From like 10 years are going to be regulated. 10 years are going to be regulated. In the next 5 years are going to be regulated. And then now we're like, everybody's on the same page. It feels like everybody's working towards the same common goal. So maybe it will actually be in the next 10 years.
That'd be wonderful. That'd be great. That'd be so nice, eh? Yeah. That'd be wonderful. Because I remember hearing about it a while back. Yes, and it kind of moved quick at first, and then it sort of stalled, and then now that's great to hear that it's picking up momentum.
Now it's creating policies and arguing over those policies.
Right. Yeah, exactly.
True story.
Totally.
Sorry,
yeah, for sure.
Code. I know, I'm complaining about being cold in California. Shut up.
It's okay, I'm warm right now, so probably the pneumonia talking, but yeah.
Yeah, I'm gonna say it's the pneumonia talking.
Yeah.
We have plus temperatures today with snowman snow for like almost 2 hours.
Ooh, I love snowman snow. That's the best snow.
I agree. Yeah.
Yeah, my kids didn't get to go play in it because they're both coughing too, and I'm like, you are
Oh.
not getting this. You are going to rest all day. Their cough does not sound nearly as gross as mine, so I think we're okay. But fingers crossed. So
Yeah, well, hopefully. Yeah, I'll cross my fingers for you. That sucks.
thank you.
For those
Sorry.
of you watching, when we all got on here and we heard the coughing, we were like, we could reschedule this. Like, she's pulling through, being a trooper right now.
It's only 3 weeks. It's fine. Yeah.
Y'all better be very, very appreciative right now.
Yeah. Exactly.
Show your appreciation.
Exactly. All the likes. Yeah.
All the likes. Yeah.
Every single one of them, all the ones in the world.
Yes, exactly.
If anybody watching wants to go and follow, I'm just throwing up on here. Why does it always go way faster than I want it to? This is how you would find Allison at Lifemark Stonebridge. If you want to go and follow social media and check her out there, and check out the other therapists and both massage, physio, chiro.
Yep.
Yeah, and chiro. I couldn't remember if there was chiro or not. Sorry.
Yeah. Yeah, we have 6 physios, we have 3 massage therapists, and 1 chiro.
Wow.
So, yeah.
Wow, that poor chiro.
Yeah. He's very outnumbered. Yeah.
Jesus, that's a lot.
And
Granted,
it's
they
a
can
very female-dominated staff, too.
bang
So,
through. Oh, yeah, that's true. But a
Yeah.
chiro can bang through so
Oh,
many
yeah.
clients, and that was, I realize, not the greatest way of saying that, but you can go through, I want to say run through, but that also doesn't sound
It
great.
doesn't-
Gives you see, treats.
Treat, see, crack,
Yeah. Yeah.
All the things.
all the
All
things,
the things. Exactly.
all the therapeutic things.
Yes.
As opposed to physio or
Mhm.
massage, where we have a longer time frame with our
Yeah.
client.
Mhm.
That's fun.
And I think it's nice having all 3 in-house for that reason.
Yeah.
So that we can refer between each other to give our clients that full body approach and that holistic approach, because we all kind of have our areas that we maybe specialize a little bit more into. And so, yeah, it's great having everybody together, because then we can bounce ideas off of each other too, which is nice. And yeah, we have different treatment length times. So like, especially if I have someone where I'm like, man, this muscle tone is just not going away, and I am at a loss. I'm like, okay, so you want to go see Cora for an hour massage? Make her break this tension. I mean, I can do the other things. So
Oh my gosh.
yeah.
Yeah, no, I have to say, that's one of my, I love being in a clinic that has different types of
Mhm.
practitioners. It's, I didn't realize how valuable it would, like I knew, but I didn't really
Yeah.
realize until I
Mhm.
actually got there.
Yeah.
Yeah.
It's nice. And being able to like, okay, we can piggyback off of each other, or like, okay, hey, I already gave them some exercises, so you don't have to worry about that. Or you're like, oh, did you give them this stretch? Oh no, I didn't. That's a good idea. Like it's really nice to be able to tag team.
It really
That
is.
also sounds bad, but yes.
Yeah, we'll work together. Work together.
We work together. Exactly. Exactly.
Yeah, we are a
Yeah.
fun group right now. And I told
Minds
you
are
we
not in
laugh.
the gutter at all.
Oh no. They're all above board.
Oh, totally. Totally.
I told you we laugh a lot on this podcast
I
together.
love it.
So I'm so sorry for your cough and for your pneumonia
It's
today.
all good.
Oh. So what would somebody find surprising about what you can do?
I think probably the variety of things that we can do, and the variety of things we can treat. Because I do think a lot of people do think of physio as like sport related,
Oh, a lot, yeah.
right? They think of, okay, yeah, this injury, that, and like I said, I mean, you'll see physios in the hospital, home care, plus the private clinics. So I have colleagues who, all they do is treat heart and lung stuff in the ICU
Which
every
is
day.
crazy to me.
Right? Yeah. Yeah, like I worked in the ICU on my very last placement for physio school. So I was channeling my like 13 years ago self. What do I do for this? What breathing techniques do I need to do to work on this pneumonia? We can do stuff like suctioning. So I did that a few times on people who come in with overdoses actually and were in induced comas, to suction stuff out of their lungs to help with that. Right? Yeah, exactly.
Did you know? Did you know
I did
this, Cora?
not.
Yeah.
Oh, keep going. I want to have
Right.
more.
So like stuff like that. Like the chest physio stuff with like your pounding. So I mean, kind of like massage techniques, honestly, but to get secretions moving. We would go down and help in the ER even sometimes if we had someone come in. That might be looking more at like, okay, what's their mobility? Are they appropriate for potentially being able to go home? Stuff like that. So we do a lot of that kind of stuff, especially in hospital, is like, can this person functionally get back home? Be it post-op or they've come into the hospital. I actually had to do CPR in the hospital once because I went down to the ER to help with something and someone coded. So I was doing compressions. The doc's like, you ever done this before? I'm like, not on a real person. He started singing in the OR, or the ER, it was a whole thing. But so it's kind of neat. I mean, when I worked in neuro for my placement, there was tons of people with strokes, but head injuries and stuff like that. So lots of mobilizing people, working on getting function back. And then in private clinic, like I do, I think one area that people don't realize is like the really chronic nature of stuff. We do a lot of long-term disability files in our clinic. So people who have been off work for a long time, who need rehab programs to get back to work. The one big area, and I just think this is like something in general healthcare people don't realize, the jaw. Lots of work on the jaw. Do you you probably see that as massage as well,
So
right?
much.
Work on that, right? Yeah.
3 people that I work with, let alone my clients.
Right. Right. Yeah. It's like, it's a joint. It has muscles. It makes sense, but we don't think of it. Yeah. Yeah.
Yeah. Everybody always seems to be surprised.
Yeah. Yeah, exactly, right? Yeah. And then, adding in like the acupuncture and the dry needling component of things. We have vestibular therapists at our clinic as well. So treating balance and dizziness, vertigo, that kind of stuff.
Hold the phone.
Yeah.
Physiotherapists that specialize in vestibular.
Mm-hmm.
I
Yeah.
need to see if I can find what I have a client right now.
Oh, yeah.
A vertigo, tinnitus, and she's got
Mhm.
the pulse, like she feels in her right ear the pulse, and
Yeah.
nobody's been able to help her.
Oh, yeah. So
Not a
that would be a great
single
referral
person.
then.
She's gone to neurologists, she's gone to endocrinologists, who, by the
Yeah.
way, her doctor sorry, I'm taking over for a second.
No, this is interesting.
This was a news story today that I found out. Her
Yeah.
doctor a while ago, like years ago, saw that her thyroid levels were low
Okay.
and did not send her to an endocrinologist and just said, here, take these pills.
Mm.
Years later, she finally goes to an endocrinologist because her vitamin D was at an almost toxic level.
Oh, God.
She was like, yeah, I just took a lot of vitamin D pills because I wasn't getting out in the sun, and I heard that it was good for you.
Oh, boy.
Oh my gosh. If you're
Vitamin
watching
D.
this, she laughs at it now, right? So if you're watching this, my dear, you know who you are. And I'm so glad that you decided to go to the endocrinologist. That was the best choice you could ever have made. And then the endocrinologist was like, I don't think you have hypothyroidism.
Oh, no.
So they took blood work. She went off the pills. 30 days later, took more blood work. Both times fine.
Oh, jeez.
So yeah, she was. Anyways, that's her one fun story. But she's been having vertigo and the pulsating stuff on the one side, and now her whole right arm is starting, like her shoulder all the way through is getting really weak.
Oh, wow. Okay.
Alongside of really tense and tender because she works at a desk and all that stuff all day. But you're telling me, because I did not know this, that there are physiotherapists that have a specialization there.
Yeah. Yep. Yeah,
Been a tell for that.
vertigo, dizziness, benign, paradoxical, blah, 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 vertigo, BPPV.
BPPV.
Yeah. Yeah. Whatever that all stands for, you know.
I'm gonna find one for her because I also have Meniere's. It doesn't
Yeah.
happen very often for me, thankfully, but I would love
Yeah.
to do that.
It's really interesting. And they're trained to kind of look at that system. And then if there isn't necessarily something with the vestibular system, something maybe more neurological, then they're going to know how to help with that next referral process and stuff too.
The neurologist was like, "There's nothing wrong here."
Great. So yeah, there you go.
Got
So it's
literally 0 out of the
vestibular stuff.
neurologist.
So yeah, I think that would be a great referral for her then.
Yeah, you know what? I'm
Yeah.
gonna put a little note in my file for her
There you
right
go.
now because I'm gonna forget if I don't do it right now. So talk amongst
The
yourselves.
same way. Yeah. We actually saw a lot during COVID, and we're still seeing a little bit of it now, maybe not as much, is people struggling from like the long COVID things, which often had some dizziness and vertigo type things with it. But we saw a fair bit of that. Our company had put together some training into like specific rehab programs for working with people with long COVID. So we had a lot of long-term disability files with that, and kind of in particular. We also, not in directly in our location, but in our company, we have people who treat pelvic floor. So that's, again, more specialization after you're done school.
I worked with a physio who did pelvic floor.
Mm-hmm.
So cool.
Yeah, so cool. And it's funny because, I mean, like, okay, yeah, so majority of it's going to be women, of course, because you're looking at a lot of this being postpartum.
The one that I know, not
not
male
always.
therapist, and super cool. Anyway, sorry, keep going.
Yeah, it's really neat. Yeah, and I mean, it's pretty well female therapists doing it, but yeah, you see people who they've never had a baby. They're still having problems with pelvic floor. And male therapist or male clients as well. Actually, I've had, I can think of at least a handful of male clients I've sent over to our pelvic floor therapists in the year because of incontinence or any number of different things, but primarily incontinence is the big one with men, but pelvic pain and things like that. So not maybe as common, but it still happens. Yeah.
So cool.
Yeah. It's neat. And then there's concussion rehab, of course, which, I mean, that ties into the sport a little bit, but as much as physios legally cannot necessarily diagnose a concussion because there's many aspects to a concussion. But we can kind of go, you have a concussion in this realm of things, at least in conjunction with doctors. And we can't clear a concussion to go back to sport or something like that because it has to be a doctor or it has to be a nurse practitioner. But we do pretty well everything in between, looking at how do we rehab that, all of the aspects of that, which has changed so much in the last 15 to 20 years, from going to sit in a dark room and don't look at anybody or anything. And now it's much actually like, okay, no, we need to challenge your brain in the appropriate ways. Look at the neck. Sidney Crosby, just say that, drove me nuts when they came out, a year later being like, oh, it was his neck the whole time. Who didn't look at his neck in the first place? Come on. My beef. Sorry.
Please. We love talking beef.
Right?
Please talk beef.
Like physio concussion 101. If there's a concussion, look at the neck. Like I worked with football for, I guess that's something I didn't say in my intro, is I did work with sport for a very long time. So I was your classic physio there because I worked with the Saskatoon Hilltops, which is the Canadian Junior Football League. I worked with them for 11 years. I worked with the University of Saskatchewan Huskies hockey team for a year. I've worked with some other hockey through that. I've worked with Football Saskatchewan, and I've worked with the provincial teams, and I've actually worked with Team Canada and gone to 2 national championships with Football Canada. So I have a ring that says that I'm a world champion. So
you are a world champion.
I'm a world champion. In 2016, I went with the men's team when we beat the US in the final in China to be world champions. So So I have a lot of experience with concussions from that. Worked
Yeah.
with judo, oh God, what else? Rugby. So I've seen a fair number of concussions in my time.
Rugby.
Yeah. So
Ooh.
it's just a little bit of experience with that. Um, and what else? There was something else I was thinking. Oh, cancer rehab, which is probably something people don't think of for physio
Or
as well.
massage.
Yeah,
Yeah.
right? Yeah, exactly. So, I have just wrapped up with someone actually on a cancer rehab file, just not too long ago. Got her she's back to work now, which is great. And then just started working with a gentleman who has cancer and, a WCB file at the same time. But yeah, so
Ugh.
yeah,
Oh,
he,
that sucks.
yeah, just the chemo and, all the different things, a lot of deconditioning, and he's a guard. Well, not really a guard. He works in the hospital as, like security, so he
Mm.
has to sometimes restrain people, if we'll put it nicely.
Yeah.
You
And yeah,
could add concussion onto that, possibly.
he could. Yeah, exactly. Yeah. Well, because of his cancer, he got kicked in the arm with a combative patient, and it broke his arm because there was a tumor in his arm, and they didn't know. So,
That's one way to find out.
yeah. Yeah.
Wow.
Yeah. Yeah. Here's some stuff. Yeah. Yeah. So we see a little bit of everything.
Yeah.
Yeah. Yeah.
I see.
Yeah. Different neurological conditions, stuff that kind of comes out of nowhere. But yeah, spinal cord injuries. I had a client who had broken his neck diving into a swimming pool, and they told him he never walk again. But he walked into our clinic 5 years later,
Oh.
and I got him back to work. Um, I was slightly disappointed in some of the care he had received previous to that, but he was in a very, very rural area with not a lot of access to program and appropriate care. So that was partly the problem. But with kind of getting the right education on how the nervous system trains and reacts, that was the biggest thing. It was like they were trying to really push him to do all these things to get better, get back to work, but not taking into the account that he had literally had a spinal cord injury and his nervous system was no longer, it wasn't working the same as it had before. So once we tweaked some things, big difference. So, yeah.
So I want to do another one of these podcasts with you where it's just talking about cases.
Oh, cool.
Because
Okay.
you're gonna have some
Yeah.
fun cases to talk about for sure.
Yeah.
Ugh.
I've seen some interesting things in the last 13 years, that's for sure. So,
Oh yeah.
yeah. Yeah.
Adventures.
Yes. Yeah. Yeah. Everything from the very acute, and it's actually surprising because with physio being so thought of as like an acute thing, you don't actually see that many physios right on the sidelines doing that like super acute case management. You see a lot of like there's physios, don't get me wrong, and athletic therapists, but I mean there's only so many sports teams and only so much stuff like that, right? So it's a very, very small percentage of what we actually do. So, and when it comes to like sort of that really acute on-field management, there's not a ton. So I laugh because sometimes when I'm in, we had a situation in clinic a few years, well, more than a few years ago, because my old boss was still there, and I was in my treatment room, and I heard on the door, and I opened the door, and she was kind of freaking out, and I said, "What's going on?" And she goes, "My client's in the room. His heartbeat is like 200 beats per minute. I can't get a blood pressure on him." I'm like, "Is he conscious?" And she's like, "Yeah." And I'm like, "How?" But okay. And I said, "Have you already called the ambulance?" Because I was just like immediately. And she's like, "Yeah, the reception or the admin was going to." And it was our office manager. And I looked at her and I said, "You need to tell them on the phone that it's a heart event because that will get them here quick." And yeah, he wasn't a very big guy, and you could see his heart beating in his chest. Like it was beating so fast, you could see it. And so she's like, I'm not good at taking blood pressure with an actual like stethoscope and cuff. And so we did that all the time at football. So I said to her, I'm like, I'll try, but I tried, and you couldn't even get the beats because all you could hear was the whooshing of the blood because his heart was going so fast, you just literally couldn't get a blood pressure on him. So I tried a couple things to try and get him back into a normal rhythm, but it was the doctors actually, it took him a week in hospital. They had to shock him to get his heart to go back into a normal rhythm. But yeah.
Wow.
Fortunately, because of doing my on-field stuff and doing some of that, working with some like docs in that and knowing some paramedics, I knew some tricks to try and help get him back into a rhythm. It just none of them worked. So, but
Wow.
What
Yeah.
is he? Was he okay after?
he's good now. Actually, it was so super funny because we followed up with him. He was still in the hospital. Yeah, they said we don't really know what's going on. Shocked him to get him back into rhythm, and like probably, gosh, it was right when I got back from mat leave with my daughter. So in 2023, yeah, 2023, had this guy come in to see me and treating him, and he said something, and I went, "Wait, did you have the heart thing happen here?" He's like, "Yeah, that was me." Like, I was like, "No way!" I didn't recognize him, and I said, "So what's going on with that?" He ended up having a procedure to try and nip it. They eventually kind of figured out what was causing it, and he's doing really good now. And yeah,
I'm so glad.
Win.
so, yeah.
Oh my gosh.
Wow.
I am curious about something.
Mhm.
It's so funny at the beginning of this. Cora, take point, and I just have not stopped. I'm so sorry, Cora.
Okay.
I just have I'm so curious. Um, a lot of times in the field of massage, you'll have people say, "Well, oh, it's a 5-year career. You can't do anything past the 5 year." Do you guys face anything like that? Like, do you guys face the whole, "Oh, you can't do physio forever"?
I don't think we hear it as much as you guys do. Um, I remember there being a study that we talked about in school, more applicable to massage therapists, that said if massage therapists don't take care of their body, they have a 9-year shelf life, basically. But our profs were like, "You're not that far off, honestly, as physios too, for how much you use your hands. So yeah, you too have to make sure that you protect yourself and take care of yourself because it is such a physical job." Especially for, I guess it depends on kind of what tact you take, I guess, with physio. So someone who works in the hospital, maybe a little bit less worry in that kind of regard because you're more helping mobilize. You're getting people moving a little more functional. You're not really, like, getting in there with your hands quite as much, but myself as like, in private practice, musculoskeletal, I do use my hands a lot. I'm digging and I'm pushing and poking, and I have bad thumbs for being a physio. It's just my normal. So then if I push more, yeah, hitchhiker's thumb. So and then my fingers lock out like this.
We're twins,
Yeah,
Allison.
yeah. So I have to be really careful with my hands. And so, like, especially when I'm working on people's necks, if I do too many people's necks in the day, I have to be really careful with my hands because it's just so many little things. So
Mhm.
I've also learned how to use the old elbows, just like I know you guys do, and things like that. And we do really preach when I help teach at the school for a little bit in some of the labs. And whenever I do have students, that's one thing I kind of hark on them about a little bit is like
Mhm.
protect your body, biomechanics, make sure the table's in the right spot, how to use your whole body and not just your arm or your shoulder. Um, and like yeah, certain techniques, like I'll say to my students, I'm like, "Look, I'm almost like I'm dancing with my client here because I'm using like my whole body to do a movement through their back, maybe if I'm mobilizing the back or something like that. I'm not like when I treat the upper back, people are like, "Are you on your tiptoes?" I'm like, "Yes," because I've got all my weight and I'm using it, right? So, um, I don't think there's as much talk about it, but yeah, it is definitely something I try to be really conscious of because I know that if I'm not careful, my hands are going to give up on me. So which is partly why I did my acupuncture and my dry needling, because I knew that it's something that kind of is longer term for me.
Cool.
And I think that we got it a little bit more in school at the U of S, only because we had a prof who I think was 5 years into her career, and her hands were starting to give her way too many problems. And so she went back to school and got her PhD and now does research. But she was really on us a lot about hands and stuff.
That's so important.
Yeah.
Oh, yeah.
Yeah. So it just, would depend on the physio a little bit. But especially in private practice, we use our bodies a lot. So I try to watch myself. So, yeah.
Well, Cora, do you have any more questions for our intrepid Allison?
Well, I was going to ask about tools. Like, do you use, as a physio, do you use tool? You mentioned the needles. Are there any other tools that you utilize?
I don't have a ton. I'm trying to think. Well, I guess I do more than I think. That's always the funny thing, hey, is you don't always realize what you do until someone asks you a question. Like I use the muscle release stick a lot, especially when I'm working on people's legs. It's just like those big old quads. Just let me.
What is the muscle release stick?
Oh, it looks like a giant rolling pin, basically.
Okay, so kind of like my bamboo.
Yeah, probably. Yeah. We have some fancy ones to work that have like they're beaded or they're kind of like a foam thing, but they're really basically just a glorified rolling pin. That's what I tell my clients. I'm like, you could buy this $30 massage stick, or you could buy a $2 rolling pin at the dollar store. You choose. So I just use a rolling pin at home personally, but yeah. So I'll use that. Sometimes I'll get people to do like certain things. We'll use this sounds kind of crazy. Towels and pillowcases sometimes to do certain techniques.
Yep.
To use for traction or to do certain joint mobilizations, stuff like that. Not quite like you see some of these recent chiro like videos where they're like wrapping around their head and just yanking them off the table. Nothing like that, but yeah, we were talking about that with our chiro at work the other day. But and actually so transfer belts, which you see a lot of use in the hospitals, because you clip one of those on pretty well every single person you're moving around, so that if they start to fall, you can kind of help them. But we actually use them at work to do certain mobilizations and tractions and stuff like that too. I don't really use a lot of like massage tools type thing. I know some physios who do, and there's some physios who do something called Graston, or well, it's just basically instrument assisted. Hey,
Yep.
So there is, I think, one or maybe two physios now in Saskatoon who do that. I've never used any of the tools, but I don't think I have. I've played around with them on myself from the massage therapist at work, but yeah. And cupping, actually. Cupping is something physios do as well. Probably not as much as you would see, like, with as much training as massage therapists. We don't use, like, I don't know any physios who use the glass suction ones. We just use the silicone, like,
Honestly, most massage therapists, the silicone is it's easier.
It's so easy.
Yeah.
Yeah. And easy to manipulate and move. Hey, like, yeah.
They're better. They mold better.
Mm-hmm.
And they don't pop everywhere and go flying across the room.
Exactly.
Don't have to worry
One
about
of my old bosses used like the glass ones with the fire, and I just like it's just too high risk, honestly.
Yeah.
I just like, what if you burn someone? Like, honestly, the silicone ones are gonna work so nicely. So yeah, like stuff like that. I guess it's not quite a tool. I mean, it could be a tool. I mean, we use a lot of modalities, so ultrasound, TENS machines, which is like, for the person who's not like doesn't know what a TENS machine is, Dr. Ho.
Back up.
Yeah.
To the ultrasound.
Yes.
What?
Well, so not diagnostic ultrasound.
No. Therapeutic.
Therapeutic ultrasound. Yes.
That's who I go to do that?
Yes. So, and can be used for so many things. So okay, here's going back to your previous question about some things that physios can treat that people be like, what? Warts. Ultrasound. Works like a charm.
Really?
Yeah. My cousin's son had these warts a few years back, and they were going on this big trip for months away. And they had gone to the doctor, like, how many times to kind of get these things burnt off and frozen off and all the things. And she's also physio. And she goes, yeah, you have ultrasound in your clinic. I'm like, yeah. And she goes, can we try it? And I was like, yep. So she came in, and basically we just put the ultrasound machine on as high settings as it could possibly go and blasted the ever living heck out of them. And yeah, in a couple of treatments, they were gone.
I am so irritated right now. I've been thinking about doing ultrasound treatments. I have Morton's neuroma, and I have issues with bursitis, chronic bursitis issues.
Yeah.
I had no idea where to go, and I was way too lazy to look it up.
Physio. Yeah. Yeah. So yeah, ultrasound. It's so good for so many things. You can use it for anything that's acute to something that's super chronic. And it's funny because you get people who sometimes are like, I don't feel anything. So is this actually doing something? Well, if I stopped moving it, because we constantly keep it moving, if I held it in one spot, you go feel it, and it's going to hurt. So it's often one that people don't really feel, but it's amazing the effects after, because I sprained my ankle and I was helping teach the lab for ultrasound at the school. So I was like, here, real life situation. Here's students. This is what happened. Tell us what settings you would use. My friend ultrasounded my ankle. She's like, it's only been 3 of the 5 minutes. Can I just stop though? I'm like, yeah, it's fine. I'll ultrasound it more at work later. And she had pushed on the spot before we started to show the students, okay, go, you assess the pain. And I was like, damn, like I was like almost kicked her because it hurt. And then she pushed on it again after, and I didn't even react. And all the students are like, did it not hurt? And I'm like, no, it didn't actually. It's amazing. It can take away pain. It can take away inflammation. Chronic stuff like scarring or warts. Done. And then it's funny because like Dr. Home machines, which are like the rave, is just a glorified TENS machine. It's a brand name TENS machine. And honest to God, you can buy one for half or a third of the price at a physio clinic instead of paying the like $250 you're going to buy for a Dr. Ho.
I have a lady right now who has just an insane amount of scar tissue in her knee from injuries and then from 2 different surgeries, and nothing is working. I have been with her for a couple of months now, and I've not been able to touch it.
Oh, wow. Yeah.
Like I can literally physically touch it, but I haven't been able to change a darn thing. And thank you.
Yes, for
and
sure.
Cora, thank you for suggesting that we bring Allison.
Oh, I'm glad.
Oh my God.
Oh yeah, I'm really glad that you were able to come on today, because I feel like, because even a lot of what you had said with the description of what you did, I had kind of associated with OTs.
Oh yeah. Yeah.
I guess whereas like getting people in the emergency setting, in the hospital setting, getting them moving, assessing if they can go home or not.
Yeah.
In my experience, those are always OTs. I'd never actually, like in my experience in the hospitals, there was never actually a physio that came and communicated with the rehabilitation of the family member that I was there with. They were always OTs. So I kind of associated all that with OTs, not necessarily physio.
Yeah, and excuse me. Depending on where you are, we worked really hand in hand with OTs a lot in the hospital. Like there would be times where in the morning especially when I worked at RUH, just with it being like the big hospital in Saskatoon, we would, if we got a new referral for someone on one of the wards, wherever, we would like usually bounce over to the OT department and be like, hey, who got so-and-so? And we would sit down and go, okay, this is what's going on. And a lot of the time we'd actually go up and assess together because there was a fair bit of crossover. So that way then we could, it's like, okay, here's the physical side. And then they might take over more of the, like, okay, do they need special equipment for at home? And they kind of maybe take that side of it a little bit. Like we know how to fit for wheelchairs, to assess for mobility aids, and do all of that. And we can do all of that. I do that sometimes at work. I've written scripts for different types of walkers or wheelchairs or whatnot. But OTs definitely have a little bit more into that, and especially some of the more specialized equipment. And then they might do a little bit more of the, like, they do a lot more hand therapy than we do. I mean, we can, like, I do work on hands, but some of the really more complex hand stuff, sometimes I'm like, I think you better off to see an OT than me, because they just whole other ball game with
Mhm.
some of them. And so sometimes they'd be more, yeah, a little more on the function, but it would depend on kind of the situation too. So yeah,
So
we kind of maybe look with the more general full body function. They might specify more into like, okay, do they need adaptive tools at home for eating or stuff like that too. But yeah, a lot of the time it was nice we could go in and work with them together and kind of tag team our assessment, just because there was so much overlap, which was nice.
that would
So
be really nice.
Definitely a
Mhm.
win.
Mhm.
yeah,
Oh,
yeah.
well, Allison, thank you so much for joining us, for coming close to our hour mark here. For anybody who's been watching, or when you watch this later, all of the stuff has been scrolling on the bottom if you want to find any one of us. LifeMark is where you're going to find Allison. CNC Learning Hub, of course, is the business. Cora has her own, which is Cora Peters RMT, and then mine is Just a Massage Therapist. Also, just as a reminder for everyone, we do have our free guest membership going that has the free personal self-care course on it, and is kind of your gateway into everything that we offer as well. You can go on to cnclh.com to check that guy out if you wish. Otherwise, I think that was a really fantastic time. It was really fantastic to have you and actually get to learn so much.
So much. Thank you so much, Allison.
Oh, thank you so much for having me. I had a wonderful time. I'm sorry about the coughing.
We're sorry that it had to happen this way. Oh my gosh.
Well, I had to laugh because when I think 3 weeks ago you and I first touched base, Chelsea, and like kind of figuring out the setup, and I was coughing a bit and said, "Oh, I'm sure in 3 weeks from now I'll be fine." And
Uh-huh.
here we are. So
Yeah, the coughing last time was just here and there.
exactly.
Pneumonia.
At work, I was like, "I'm sure it's just viral bronchitis. I mean, maybe pneumonia, but I'm sure it's not that." Joke's on me. So
Nope is. All right.
mhm.
Well, we will 100% see if you want to come back on and just talk cases, because
Yeah,
it's
I'd
one
love
of
it.
our favorite things to do. And at the end of every
Mhm.
month, we always have someone come on, except for the end of this month because we won't be here next week.
Right.
Da-da. But yeah, at the end of every month, we like to have a guest on, and we would love to have you back and do some
I would love that.
case chatting.
Yes.
All
That'd
right.
be wonderful. I would love that so much.
All right. Well, that is it for episode